Hello, I am Dr. Minish Jain. I am medical oncologist at Pune. We will be discussing lung cancer today. Lung cancer is a very serious problem. 1 in 4 deaths are due to lung cancer. If you consider it like the cancer deaths are more with lung cancer than breast, prostate and colon put together. Every 15 seconds there is a new cancer being diagnosed, lung cancer being diagnosed worldwide, and every 18 seconds there is a death happening because of lung cancer. Now this is one of the most preventable cancer we can consider, and the other serious concern to our nation is like in India we are seeing a lot of youngsters getting this cancer even up to age like 25 and 30. Worldwide if you see, the cancer is generally after age of 65. Most of the cancer patients are above 65. Very less number of patients worldwide are less than 45 age. But in our country, two problems. One, younger age and non-smokers are getting diagnosed with this cancer, which is a very serious concern. This cancer was considered a lifestyle disease, like 85% of the cancers are due to smoking. Now, if you just stop smoking, 85% of this cancer will be gone, and a lot of death which was happening because of lung cancer will not be seen. But the problem now what we are facing is, other than smoking, passive smoking, the risk factors which are there, the new risk factors have come up, like it can be either a previous radiation because of another chemo, some occupational risk like arsenic, cadmium, nickel, coal tar, diesel exhaust, indoor and outdoor pollutions which are there. So these are also a risk factor. Then asbestos is another risk factor, VOCs which are from the paints, and then we have radon which is coming from the uranium. When we are digging the soil, we are getting radon which is also causing a lot of lung cancer. So there are multiple reasons now why lung cancer is on rise. The water also may contain arsenic, the food habits are going down, obesity is going up, there may be a small percentage linked to chronic infections, there may be a small percentage linked to genetic factors. So a lot of new reasons of lung cancer other than smoking. Earlier we had other problem, like there were chulhas which were being used and that used to create smoke in the house. How do we look at these symptoms? How do we consider somebody has cancer? Like if the cough is not going away for 2 to 3 weeks, if there is blood in cough, if the person is having wheezing, facial swelling, arm swelling, bone pains, loss of weight, and if there is like a person who has been smoking for a long time and you see a suspicion of these features, then you can start evaluating them. Now, how do we diagnose them? That's another concern. Like the diagnosis is usually based on clinical diagnosis, X-ray, bronchoscopy, CT scan, PET scan, biopsy. So these are very simple things which we can do to diagnose them. Generally, a PET scan is recommended these days, and we generally would look them into 4 stages. Stage 1 to stage 4, 80% of these cancers are in stage 3 or 4. Very few patients are in stage 1 and 2. And early screening, early diagnosis leads to a better treatment and a possibility of cure. One more important thing other than smoking I would like to highlight these days is like e-cigarettes, which are becoming very common in youngsters. And these e-cigarettes are known with various names. So they may be called e-cigarettes, they may be called JUUL, that is a juice USB lighting system, ANDs, vaporizers, vapes, tanks. So there are multiple names to this. Basically 1 in 5 youth are being addicted to this. Now they consider that this is very safe. The cigarette smoke contains 7,000 chemicals and 69 carcinogens. But e-cigarette also causes lung cancer, causes lung diseases, causes neurological problems, causes cardiac issues. So there is a electric cigarette or e-cigarette has a tank, lighter or a battery which puts it on and off. The tank has a vaporized liquid which gets vaporized by the heating flame, and then there are VOCs, volatile organic compounds, and there are flavoring agents, diacetyl, which are also considered very harmful. And JUUL is a very addictive thing. 1 in 5 youths today are getting addicted. There is a study internationally that they are showing that even school going students are now getting addicted to these e-cigarettes, which is also very harmful. One more thing I would like to highlight in our country is the drivers and the diesel exhaust, which is they're exposed to. There is nitrogen dioxide, there is nitrogen oxide, there are particulate matters which are causing damage, and they are also causing a lot of cancers due to this. So we need to be careful that diesel exhaust is also a very big contributing factor. Now lung cancer earlier was considered as one disease, like we used to think that it is end of a person and it's one disease, and we used to try and put everybody into same basket. But one size doesn't fit all. There are a lot of mutations in lung cancer. So when we're talking of lung cancer, we initially separate them out into small cell malignancy, which is always linked to smoking. 90% of it is linked to smoking. The other one is non-small cell. Non-small cell is like adenocarcinoma, large, NOS, or squamous cell carcinoma. Now they have a lot of mutations in them, and each mutation can be treated differently. What is happening today is a lot of females, Asian, non-smoker, adenocarcinoma may have good mutations. 80% of them may have good mutation, and 20 to 30% of these females who are getting cancers are not linked to smoking at all. 10% of males are not linked to smoking at all. In fact, I would say 50% of patients in India, what we are seeing, youngsters, are not related to smoking these days, and these patients may have mutation, and these mutations are called driver mutations, which are proteins altered and driving and creating cancers. So they may be multiple, like I won't go in details, but they are EGFR, ALK, ROS-MET, BRAF, NTRK, and so on, and they have different drugs to be treated. When you have a mutation, they do not respond to chemotherapy or immunotherapy. But if there is all the driver mutations are negative and there is a PD-L1 high, then you have immunotherapy. So how do we treat lung cancer? If supposing somebody comes to you very early, as I said, 1 and 2 stages are just 20%. Early stages up to stage 3A, you will be considering them for surgery. So surgery is a gold standard. But if patient has stage 3B, 3C, 3B sometimes can be operable, but 3C, 4A, 4B, then all these patients are definitely being treated by either chemoradiation or chemotherapy depending upon the situation, and then based on their targets, like if we have a targeted drug, then we would use a targeted drug to alter the protein and change the outcome of cancer. Now how does cancer happen? Cancer happens because of a alteration, because of a repeated injury to the lung mucosa. Like if you are a smoker and you are smoking all the time, you are creating a damage. The damage gets repaired. But as we keep smoking and we create the damage, eventually it leads to a mutation, and that mutation becomes a driver mutation. Now if you know a driver mutation, you can attack the mutation and change the pathway of the cancer and stop it. And this is what is going to give you a better outcome, because chemotherapy is used in patients who don't have driver mutations, and immunotherapy is used in patients who have PD-L1 high, or you can use it along with chemotherapy when patients don't have driver mutations. So these things are definitely available and the outcomes are improving. The 5-year survival today is 15 to 20% in non-small cell lung cancer, and it is around 7 to 10% in small cell lung cancer. But if you pick them early, then the outcomes can be 60 to 70% of them could be cured. So my suggestion or my recommendation is stop smoking, don't smoke if you have never smoked, avoid passive smoking, do a lot of exercise, eat a lot of greens and fruits, avoid processed food. If your occupation is like working in nickel or arsenic or cadmium or coal tar or any of these industries, take all the proper precautions to safeguard yourself and use the proper gears for that. And if you are a smoker and you have been smoking for 15-20 years, 20-30 packs, so then, and if your age is between 55 and 77, or if you are having a high risk occupation, or if you have a family history, then go for a low dose CT scan screening every year, and that could be quick way to diagnose and make sure that you get diagnosed early and get treated, so that there is a great possibility of cure. Thank you.